A new leak just surfaced that Apple is trying to create a hospital with Apple doctors and Apple tech. The question is, what would this actually look like, and why do they want to do it? When Apple released the Apple Watch in 2015, they released a standard version, a $10,000 gold version, and a sports version. And the sports version sold a lot. Like a lot. People were super interested in having a watch that they could work out with and track their progress with. People were not interested in buying a $10,000 piece of tech that would be outdated the following year. And Apple took note. The following year, when the Apple Watch Series 2 came out, the press release for it said, "The ultimate device for a healthy life." And they really focused a lot of the marketing around fitness and health as a whole. And now we're in the Series 7, and they've actually stuck with that same marketing. And they've also added a plethora of new sensors. In addition to the heart sensor, there's a blood oxygen detector, AFib detectors, and even the ability to buy a fitness subscription plan that will help you stay on track with your working out. So it's pretty clear that Apple is focusing a lot on health through the Apple Watch. Question is, why? Let's start with the charitable and humanizing reasons, and that's that Apple has a lot of money and a lot of resources, and it seems like one of their core values is helping public health. And their technology like fall detection and AFib detection has actually saved countless people's lives. But obviously they're also a business, so there's more to the story. And one of the reasons, and really important reasons, is ecosystem. And I feel like there's so many explainer videos on why the Apple ecosystem is incredible, so I'm not gonna make that this video. But the thing that I will say is that all of Apple's products work really seamlessly, and there's so much synergy between them. Like, it's very rare that if you buy one Apple product, it's gonna be the only Apple product that you buy. If you buy an iPhone and then you need headphones, you're probably going to buy AirPods or the AirPods Pro. If you have a Mac laptop and you want a tablet companion device, you're probably gonna buy the iPad so you can use Sidecar. And if you want a smartwatch or a fitness tracker, you're probably gonna buy the Apple Watch, because not only will it show you all of your phone notifications and even act as a way to unlock your computer, but all of your data from your Apple Watch will seamlessly sync to the health app on your iPhone. So it makes a lot of sense for Apple to have all these different product categories, and every product category that I just mentioned is huge on its own. Like wearables made Apple $8.78 billion of revenue last quarter. The ecosystem and the synergy between Apple products is a huge competitive advantage for Apple, and they can use it as leverage to seamlessly get into already established industries and make a big impact right away. But why are they putting so much focus on the Apple Watch and health tech specifically? Well, I feel like we just entered the era of personal fitness. Obviously, we've been in it for a while, but it really feels like it's taking off. Oura Ring, a company that I've actually worked with in the past, was just valued at a reported $800 million. They're like a ring that helps you track your sleep. Peloton is killing it with bikes and with their subscription workout app. So it makes sense for Apple to want to get a piece of that pie for the money aspects, but also for the health data aspects. Like if millions of people are wearing the Apple Watch and opt into sharing their health data, Apple can learn a lot about public health and then also come out with better product offerings that suit the problems that they're seeing pop up again and again. So I think I've made my case on why the Apple Watch is so important to Apple, but this whole video was created because of a leak that Apple was trying to create clinics and hospitals. So why would they want to do that? In the leak, it discusses two main things that Apple wanted to do. The first is trying out a software to help people monitor their health, and the second is opening up physical spaces for people to meet with their doctors. And supposedly both have not gone that well. The Wall Street Journal has said that the primary care service hasn't gotten off the ground, and the digital health app launched quietly this year, but has struggled to keep users engaged. So it's not turning out exactly what they hoped for so far, but I think from a theoretical level, it makes a lot of sense why they want to do these two things. Software in the healthcare industry is not great. Like obviously I'm not a doctor, so I have no experience with it, but I did do a lot of research for this video, and I watched countless doctors basically just bash the software that they have to use at hospitals. And as we're moving away from pen and paper charts and moving patient data into the computer, it's really important that the software is intuitive and works and is reliable. And that's like Apple's strong suit. And they're really good at consistent software updates and security patches as well, which is super important for health data. And it would kind of make sense for Apple to get involved in this, because not only is it their strong suit, but also it's a completely different type of business model than what they currently have. From the B2C business model, like business to consumers, this would be B2B. So it would further diversify their portfolio as well. So that's the software thing. That just intuitively makes a lot of sense to me. But the physical space thing didn't at first, and then I thought about it and I realized Apple kind of revolutionized the retail space, right? Like when you go to an Apple store and you leave, most of the time you're feeling pretty psyched, satisfied with your experience, and that is really not common. Like think about how you feel when you leave IKEA. Normally it's like you're so happy just to be getting the heck out of there, and you're also pretty frustrated with how the experience was. And a lot of people feel that same way when they leave a doctor's office. Like if you've been to the doctors in the last couple of years, you've probably experienced something like this. You arrive, There's a pretty decent wait time, so your appointment starts later than it should. And then it's also pretty difficult to book a follow-up appointment. And this isn't the doctor's fault at all. Like, their schedules suck. It's really stressful, obviously, but because healthcare is moving towards kind of like a commoditized, like, see as many patients as you can system in certain offices, it would make a lot of sense for Apple to kind of step in here and maybe improve that, because they do really well with creating appointments at the Genius Bar and still being super efficient, but leaving the customer with a really satisfied experience. And also, as a patient right now, you often have to like quarterback your own health. You're in the driver's seat very much. Like, you have to send test results among doctors, and it's kind of annoying and difficult sometimes. But what if all of your doctors had access to the same exact data from your Apple Watch? And they were able to not only check in on your data on a daily basis, but also talk to each other because they all have the same data centralized. That would be pretty cool. But I think that there are so many things to consider with a physical space that make it incredibly difficult. Obviously, you need the physical space, so the funding for that, you need the actual doctors, and then there's countless legal things that you have to consider before you start an actual hospital that is treating people and managing their health and sometimes life and death scenarios. And even creating new products for the healthcare industry is really hard. Like, you can't easily innovate on a pacemaker in 1 year. You have to make sure that it's safe and that there are no adverse effects. It's like you create the product to try to fix one thing and then it causes another problem. So unlike when Apple innovates a phone every year, they're in the driver's seat, and if they screw up, they just fix the mistake the following year, like with the butterfly keys on the Macs. But it's very different when it's directly affecting someone's health, so innovation happens at a much slower speed as well. So I feel like while on paper it may sound like a great idea for Apple to create this hospital and maybe like pacemakers and other health tech, it's actually a lot more nuanced and complicated. So here's my take. If I were the CEO of Apple, I would not want to create a hospital or do any of that for now. And I think they may come back around to that, but what I would instead do is look at my strong suits of software and logistic optimization, and I would kind of go in on that. I would try to figure out ways to work with hospitals to create better software and keep the Apple Watch at the forefront of it, where it's really going to become an incredible device to track health data. But I also think that while we're doing all of this, we need to be aware of the fact that data is really useful when it's actionable and less useful and more anxiety inducing when it's not actionable. So for example, one of the amazing health features with the Apple Watch is the AFib detection, but I watched an interview of a doctor saying that there's this inverse relationship between the people that have the Apple Watch and the people that normally have AFib. Like, a lot of younger people have the Apple Watch and older people tend to be diagnosed with AFib. So he found a lot of people are coming in with this false diagnosis. But I honestly think that it's better to have that false positive than miss the other cases that would be missed if people didn't have the Apple Watch and they're not in the core AFib demographic. So the Apple Watch is amazing for that, but I think that it's really important that there are doctors and systems in place to put the data into context for consumers. Hopefully this video gave you a little more insight into that leak and why Apple is just generally excited about health and health tech. If you want to see another episode of Tech Explained, you can watch one right here. Thanks so much for watching this video and getting to this point. I really appreciate you, and I'll catch you in the next one. Bye.